Thank you very much for having me. When Jeff phoned me to speak, I was a bit taken aback as well. But anyway, as you can see, I'm a migrant woman from Zimbabwe. I'm British now, so I've got double citizenship. I got my Zimbabwean passport last week, which is good. so which is really good. But anyway, I've been living with HIV since 1988. I was officially diagnosed when I came to the United Kingdom in 2003. So I'm one of those people who managed to live with it and not die from it for a long time. And I never really got sick from it at all, because maybe it was because of my lifestyle or something, I don't know. But I lost a lot of people to HIV, and I saw the devastation it does cause. My topic is isolation in marginalised communities, and I just had to put a definition of what marginalisation is. And it's treatment of a person, group, or a concept as insignificant or peripheral. With a population of almost 8 million people of colour living in the United Kingdom, I firmly believe that the United Kingdom, and especially Scotland, could greatly improve the way that migrants are perceived in this country. Migration is eternal. It is what humans do. With today's concept of global village, people are even more driven to move from one part of the world to another to look for employment and the betterment of their lives. Some are fleeing wars and famine in their home countries. However, this uprooting brings with it many social ills, such as depression, isolation from local community, or even developing a sense of not belonging. I still have that sense of not belonging. I've been here since 2003. I believe sometimes I don't belong to this community, because when I say something, I'm ignored. When I do something, people overlook me. And I think, is it because of my color? Or is it because I'm ignorant? Or what? I don't know, but it just happens. And people do it without thinking, actually. They just do it because you are not one of us. They just ignore you. And it affects you as a person. Recently, I was speaking to my nephew, who happens to be a consultant neurosurgeon in one of the main hospitals in England. He recalled an incident that happened one day as he was going into theatre. He, being the senior surgeon, noticed that not one of the people in the room greeted him, including the nurses. Behind him were other surgeons who were to assist with the procedure, and all the theatre staff who were there proceeded to greet them. He decided to take control of the situation and requested each member to introduce themselves to each other. He reflected to me that the reason that he was not acknowledged as he was Jew was because he looked different, that is African, and could not possibly be the head of the process. My nephew continued that even if he tried to bond with them on a personal level, he would still not be accepted because of his color. If this type of behavior happens on a daily basis, it takes its toll on one's mental health and increases vulnerability to isolation. This but one example, and I know of others, that illustrates what can and does happen to highly qualified personnel working within the NHS and other places. It is sad but true that they still get this kind of reaction in today's so-called multicultural society. At Hwupenyu, I've seen many people dealing with isolation in different ways. Some become self-destructive with alcohol and drug abuse. Some just decide to be reclusive and not mix with anyone. I have a client, I'll call him John, originally from Central African Republic, who came here 9 years ago to claim asylum after being abducted, beaten, and left for dead by his country's secret police. He woke up in the morgue, and the person in charge told him to flee, or the authorities would come back to finish the job. He left his wife and family and fled through Cameroon to eventually reach the United Kingdom. But still today, he is in the immigration quandary. The Home Office does not believe his story and denied his asylum claim. As with many others in his position, he was left homeless and destitute. The streets of Glasgow were his home. Fortunately, he found Hwupenyu and became one of our volunteers. This is someone who had a good job in his home country, but whose mistake was to get involved in politics. Earlier this year, the UK immigration officials detained him, and we at Hwupenyu worked with his lawyers to eventually gain his release. But all the work that Hwupenyu had done to get his mind in the right place had been displaced by suicidal thoughts and depression. John stopped volunteering for us and would not engage with anyone. His isolation greatly increased his mental health, increased his mental health problems. This is another illustration of what is actually happening to vulnerable people in today's United Kingdom. In general, people from Black and minority ethnic groups living in the UK are, according to Mental Health Foundation United Kingdom, more likely to be diagnosed with mental health problems, more likely to be diagnosed and admitted to hospital, more likely to experience a poor outcome from treatment, more likely to disengage from mainstream mental health services, leading to social exclusion and deterioration in their mental health. A number of factors, including poverty and racism, may explain these differences. They may also be because mainstream mental health services often fail to understand or provide services that are acceptable and accessible to non-white British communities and meet their particular cultural and other needs. It is likely that mental health problems go unreported and untreated because people in some ethnic minority groups are reluctant to engage with mainstream health services. It is also likely that mental health problems are overdiagnosed in people whose first language is not English. African and Caribbean people living in the UK have lower rates of common mental disorders than other ethnic groups, but are more likely to be diagnosed with severe mental illness. African and Caribbean people are 3 to 5 times more likely than any other group to be diagnosed and admitted to hospital with schizophrenia. African and Caribbean people are also more likely to enter the mental health services via the courts or the police, rather than from primary care, which is the main route to treatment for most people. They are also more likely to be treated under a section of the Mental Health Act, are more likely to receive medication rather than be offered talking treatments such as psychotherapy, and are overrepresented in high and medium secure units and prisons. This may be because they are reluctant to engage with services and are so much more ill when they do. It may also be that services use more cohesive approaches to treatment. At Hwupenyu recently, we were able to get funding to work with people living with HIV and support them around mental health. One of the main interventions we are using is talking therapy and friendship, and the friendship bench. The friendship bench, for those who do not know, is a concept developed in Zimbabwe by Dr. Dickson Chibanda. The Friendship Bench project aims to test the effectiveness and cost effectiveness of an existing brief psychological intervention for common mental disorders based on problem solving and behavioral activation therapy delivered by trained lay health workers, supported and supervised through technological platforms. This method has now been adopted in London, New York City, Malawi, and Zanzibar, and it is still rolling out to other places. The mental health worker is used cognitive behavioral therapy. That is what Hwupenyu is using currently with the contacts we have made with our services using this method, talking therapy and CBT, has proved quite positive from the feedback Hwupenyu is getting. At Hwupenyu, culture is at the center of what we do. Because if people do not recognize someone's culture, they are going to lose them. They will disengage. And I'm a typical example of that. There are a lot of places I disengaged when I moved to Scotland because nobody was recognizing my culture. Nobody took that into effect. I became a number. I'm not a number. I'm a human being. I might be a different color, I might sound different, but I am a human being. So if you treat me and don't recognize my culture or the way I think or the way I do things, I will disengage. My friend says, we are very good at ignoring. We ignore, and people say, why? They've just disengaged. It's just ignoring because my culture has not been taken into account. And I think a lot of people who come from my community suffer isolation, suffer marginalization, and it all starts from, it's more to do with policy rather than the word. You know, when we speak about it and then don't implement it and we don't experience it, when we go into spaces and we are treated different, we then disengage and our isolation becomes greater. Thank you.
Thank you so much, Hosanna, for that incredibly powerful and informative contribution. And I think it underscores for all of us in Scotland, and certainly for those who have a role in public life, that while we rightfully celebrate and recognise the progress where we've made it and been becoming a more inclusive society, we still have a long way to go to be the kind of society that we aspire to be. So thank you very much for that very powerful contribution.